Before we had immunotherapy, and remember when we're talking about head and neck cancer and immunotherapy, we're really talking about PD-1, PD-L1 blockade. Those have been the most tested. But before we had those agents, we really had very little at our disposal. For first-line patients, it was usually a platinum-containing doublet or triplet, the so-called extreme regimen of platinum 5-FU and cetuximab. These were effective regimens, response rates in the low to mid 30%, median overall survival about 10 months, and certainly better than single-agent chemotherapy and better than we'd had decades before. So we were making steps in the right direction, but they were small steps. For patients who progressed after first-line therapy, we had single-agent chemotherapy or cetuximab, and here the efficacy dropped dramatically. We were looking at overall survival rates of less than 6 months and response rates of single digits, usually less than 5%. And so the interesting thing to realize is that it wasn't for lack of trying. We had tried targeted agents. We had tried different chemotherapies to improve survival in recurrent or metastatic disease, but most of the studies really had failed and had been negative until immunotherapy came along.